Anti-VEGFs have revolutionized the treatment of retinal diseases. Intravitreal injections of anti-VEGF are highly effective and have markedly reduced the risk of visual impairment associated with retinal diseases such as choroidal neovascularization, neovascular AMD, diabetic macular edema, retinal venous occlusion associated macular edema, and retinopathy of prematurity. These diseases are chronic in nature and the patient may require multiple injections. Pharmaceutical compounding can help improve patient safety, reduce wastage of biologics, and save considerable costs for the healthcare system. Here we present a novel procedure for safe and cost effective compounding of bevacizumab for intravitreal use. At the compounding center, commercially available bevacizumab vials are stored in temperature controlled refrigerators. When required, these vials are transferred through an airtight pass box partition to the adjacent dispensing room where the aliquoting is done. The staff in charge then enter a changing room and disinfect their hands and feet. They then enter a second changing room and change into sterile clothing and enter the dispensing room. In the dispensing room, the syringes and vials are sprayed with disinfectant and transferred to a laminar airflow chamber where the aliquoting is carried out. Aliquoting is done using sterile 1cc syringes with 26 gauge needles to transfer 0.12 ml of Avastin, which contains 2.5 mg of the drug, into each syringe from the freshly opened vials. At the end of filling each syringe, the 26 gauge needle is replaced with a 30 gauge needle. These syringes are then placed into heat sealable pouches, which are heat sealed and placed in larger pouches and sealed. The sealed pouches are ink marked on the back side to indicate the vial used. These pouches are packed into Ziploc covers and transferred into the refrigerator for cold storage. A temperature range of 2 to 8 degrees Celsius is ensured at storage. The syringe packets are periodically transported to affiliated hospitals in secure thermocol packaging with ice packets for temperature control. Here, the temperature monitoring starts soon after receiving the consignment. Standard operating procedure for daily temperature monitoring and disinfection of the refrigerator is ensured. Before storing the freshly received Avastin packets, the internal surface of the refrigerator is thoroughly wiped with isopropyl alcohol soaked swabs. Each packet is wiped with the disinfectant and transferred into the refrigerator. Each packet has a label with details on drug quantity, batch number of the vial used, use by date, and temperature to be maintained. At the time of the intravitreal injection procedure, the pouches are retrieved from the refrigerator in a sterile draped cloth and brought to the operating theatre. Here, the outer pouch is opened by the paramedical staff, from which the inner sealed pouch of Avastin prefilled syringe is taken out by the operating surgeon under aseptic conditions as for a surgical procedure. The quantity in the syringe is adjusted to 0.05 ml, which would contain 1.25 mg of the drug. The patient is also draped with aseptic precautions and the injection is administered. Thank you.